So what I was asked to do today was to listen to what everybody was saying and try and pull all of those together and get an understanding of what the recommendations might be. And we got a very clear steer this morning from the Minister, who spoke very eloquently about the need for interagency collaboration, that it is only through inter and intra-agency collaboration that we can really build an effective mental health service. And she drew analogies with the breast cancer and the whole thing about breaking down the stigma and how you do that. So let me just forward to that. Elaine set the scene at the beginning talking about the need for coordination. So these are the thematic priorities that emerge from today. And if there's something that I've missed, please tell me. So coordination and interagency cooperation. The notion of trust was critical. It was a theme that came through most of the presentations today. How do we ensure that people can trust the services that are being offered to them? Is there a need for some kind of quality assurance as we have more entrants into this market? And how do we extend our reach? And there was a kind of an understanding that we have the idea of mental health is almost siloed. And from some of the research this morning, it's not just mental health, it's digital literacy is a really important prerequisite in terms of enabling people to get the best benefits out of mental health service provision online. That touches on internet safety and parental concerns about that. So there is a sense that perhaps maybe we need to expand the boundaries. There's a blurring of boundaries between mental health, general education, digital literacy, and other areas. Mr. Raleigh talked about the need for a national roadmap, and actually maybe some of the recommendations from today would inform that roadmap. And where is that going to take us? The kind of idea that we want that mental health organizations should interrupt, that interagency, that there's almost like a triage, in the same way that you go to accident and emergency and you're triaged. Oh, you need to go to orthopedics, you need to have an ECG to check your health, your heart, you need to go for an MRI for something else. Some kind of intelligence system whereby that can happen. So we do need to invest in more tech-based services. That was one of the things. Now, the key thing here, and because I do a lot of work around strategy and business development, what hit me was that there's 55 million in funding. And what the Minister wants to do is look at expanding the information, the reach of the information, the expertise that you guys have, and expanding it out so that it benefits the people who are engaged in traditional frontline youth services. How do we do that? And I thought that was really incredible that she's thinking, let's think outside the box is what she's asking us to do. How do we think about interagency collaboration and look at the potential that exists there? And she said the recommendations that arise from today's will be taken on board by government. So there's a tremendous opportunity that this inaugural kind of Technology for Wellbeing conference gets this level of commitment from ministers. So I think the challenge for us is to think, right, what are the recommendations we're going to go back to the minister with? And this is the first draft, and the invitation is for you to give me some more recommendations, and we could maybe put something together that would be more meaningful. In one of the breakout parallel sessions, is Owen still here? Owen's still here. Owen, help me out if I don't represent this correctly. Well, we understand what the goals are, is to support as many people as possible, give users a great deal of choice, whichever kind of counselling or psychotherapy they want, they should be able to get. We should do it as cost effectively. And the answer to meeting those needs is that we need a step care model, both within the relevant organizations, and you can read this, safely monitored. We need strong compliance, a trust framework. What does a trust framework mean? A trust framework means that all of the stakeholders who are engaged in an ecosystem have a clear understanding of their roles and responsibilities. It's crystal clear what the liability models are, and there's auditing in case there's any breach of the provisions that have been put in place. Another key thing that a number of people talked about, Kerry as well, therapeutic care pathways. Do the right research and mapping and triage. Oh, and have I represented that correctly? Was there anything else you want to add? Is that okay? Okay. It's ambitious, but I think if we're going to ask for lots of money, we want to be a bit ambitious. Now, Sean Connolly, is Sean still here? I met Sean Connolly from the, there you are, from the Irish Association of Suicidology in 2007. And there was a massive amount of resistance amongst the mental health organisations about embracing delivery of service online. It was like, whoa, we don't want to do that. We don't want the liability. This is too threatening, and this is. There's a sense in this room today, and I think a lot of people share this view, that we've reached a tipping point, that mental health service provision online is being embraced. Now, again, we come back to the trust issue. How do we ensure, and this came up in the research findings that were done, that the University of Galway folks represented this morning. People are anxious. It's like, how do I know who's good and who's not? Is there not a duty of care amongst mental health organisations to develop an accreditation system to categorise these? And Sean came up with these different categories. So we can start to build a trusted and accredited ecosystem mental health providers, so that we can intelligently have a various care pathways with different entry points depending on where you are and your needs, so that you get the service that you need. And we audit it and research it, aggregate the data, understand what works, what doesn't work, and improve constantly. So you foster innovation. You have strict reliability models, and there are commercial models that underpin this as well. It doesn't always have, I mean, that's really important because it has to be sustainable. These are the main points that came out against evidence-based. We need to have, if we're putting a set of recommendations together, I think we were bombarded with some fantastic research findings from Australia and from Ireland also. Again, quality assurance, trust, and accreditation came up. We need a kind of a holistic approach. And we need to look at those areas of expertise, like about digital literacy. There's a Safer Internet Action Plan. There's a project within Ireland that has been running for about 10 years that has a whole host of assets and resources in relation to augmenting digital literacy. So we should look around and see what's out there and pull that into this kind of initiative perhaps also. There's a set of compliance framework that has been developed, delivering mental well-being services online, that a number of organisations in this room, like Bodywise, Spun Out, Reach Out, were all involved in, and we got the support from CRC that said, yeah, we like these. I think they're out of date now already, and we need to update them. Isabel Phillips gave another recommendation: increase education for young people in digital literacy, the critical thinking, and this is an invitation to submit further recommendations. Please do, and we can put a kind of a good two-pager together to feed back to the Minister, and it would be nice to get everybody's support in that. I think we can learn from from our Australian, because you were successful in 2006, 2007 getting government funding. So there may be valuable lessons that we could learn from that. The kind of data-driven, I think if we're going to put a set of recommendations together, we should think about what's on the horizon, that we're operating, all of us, in a data-driven economy, that there's huge amounts of data being collected about us. The kind of quantified self, as I alluded to, permissioned access. What would that mean for the mental health service providers in this room? Do we have an understanding even of what that means? So perhaps there's a little bit of research and education. We have to inform ourselves about what that might mean for us and what the threat vectors are for us. So the building blocks are trust, reliability, relevance. Personalised care was mentioned loads of times. How do we affect behavioural change, and how do we maintain that behavioural change? Okay, so I think that was hopefully a good enough summary of what was discussed today.